So when you as a patient first came in with metastatic colon cancer, if you're like most folks, you really wanted to be aggressive. You wanted to do every treatment you had, and I know you want to be cured of your disease. We absolutely get that. And our initial strategy often is to be more aggressive and to treat that cancer and get it to shrink down and reduce symptoms and get it smaller. And then our next goals are sort of to try and maintain that as long as we can. So in my way of thinking, it's not how much chemotherapy or treatment I can give, it's actually how little I can give and keep that down. And when you first come in with your doc, I think most folks have what we call a goals of care kind of discussion on the first visit of, you know, where are you in life? What are your priorities? How aggressive do you want to be? What are your support systems? And then you sort of are in the groove with treatment. And you sort of, that conversation falls off. But as you go through the different lines of therapy, I think there are nice natural moments to re-talk about this. And I was just thinking that, you know, patients often hesitate to bring this up to us, but we'd like to talk about it more. So what advice would you give to a patient as they go through this around the so-called goals of care or the overall desires for the patient?
Sure. One of the most important things that I tell people is just to be open and upfront with what they want in their care. I think a lot of times people are sort of nervous to really be open and honest sometimes with the nurse or with the doctor, but really, you know, they're the ones that make this decision.
Yeah.
So.
And if you could wish something that all your patients would come and ask you, or you know, that they did better, what kind of advice would you give them to help our interaction?
I agree with Monica. I think it's very important and valuable to us when the patient tell us what you wanted and what is really important for them. Because maybe what's important for me is not the same thing for them. It's not just for patient. I think it's important to include their family members as well, their spouses and their kids and loved one. Because I think it's not just a diagnosis for one person, it's for the whole family.
Yeah, and we often, just to warn everybody, is that there's often a disconnect. I think patients out there, they want one thing. They want to be cured of this disease, and the reality is we can do better, but we can't necessarily cure folks. So what we're trying to do with them is to get more information from them, and in that context, in that bad news that you've got a bad disease, what are the important parameters that you have? And we have all sorts of patients who want to be treated until their last day, and patients who actually think about it and say they're tired of getting CAT scans and labs, and that's all okay, right? I mean,
it is. In fact, actually, I just saw one of my patients yesterday in the clinic, and she told me it's the most important thing for me to play golf. That's what she likes, and we had to adjust the treatment schedule and the dose and even the therapy we give to allow that as much as we could.
Yeah, and I know we've had many patients where they might not tell me, but they'll come and tell you later or on a phone call later. So we're talking all the time, right?
Absolutely.
Yeah. So goals of care, always important to be discussing with your team. We're listening, we're here. We'll try to do our best to meet those goals.